Welcome to the launch of Frontline Nurses, Leaders in Pandemic Response. I'm Jennifer Dohrn from the Columbia School of Nursing. And on behalf of myself and the rest of the Frontline Nurses team, we're so honored to have you here. Today's event will officially unveil the website that is over 2 years in the making and predates the COVID-19 pandemic. More broadly, it is intended to share our message with the world. Nurses and midwives have always been on the front lines of response to health crises around the world, as well as providing daily primary care. Too often, our efforts have not been recognized nor led to inclusion at the policy table. Today, we're here to talk about how that can change. Let me tell you a few words about our group. In August 2019, a delegation of nursing leaders from Zambia, Malawi, and New York City traveled to Monrovia, Liberia, and Freetown, Sierra Leone to record oral histories of nurses and midwives who served in the response to the 2014 outbreak of Ebola in West Africa. It is widely acknowledged that this dangerous outbreak was brought under control through the efforts of frontline nurses, but little is known about how it happened. Using an oral history approach, we learned about their mastery of personal protective equipment, their teaching their communities about the virus and its transmission, and how their respectful attention to community cultural practices generated widespread compliance with public health protocols. We listened as they shared their expanded roles within the healthcare team while coping with unspeakable horror. They also told us that their work was never recognized and that there was much to learn from their experiences in the management and prevention of future outbreaks. Little did we know that the world would soon be immersed in fighting the COVID-19 pandemic. As of today, with more than 117 million cases and 2,500,000 deaths, and its sharpened impact on the long existing global inequities that plague our planet. Today, a new website, Nurses on the Front Lines, makes these contributions known around the world. You will hear from many people and organizations that came together to make this happen. In the first part of the hour, you will hear from Elizabeth Iru, Chief Nursing Officer for the World Health Organization, and then from nursing and midwifery leaders in Liberia and Sierra Leone. While most are speaking live, members of our team in parts of the world where internet access is inconsistent have pre-recorded their remarks, but are still present at today's event. We are in the process of expanding the website to include the stories of nurses in New York City responding to COVID-19, and one of our speakers represents this perspective as well. In disparate areas of the world, the lessons we learn are strikingly similar. Their collective insights give us ways to move forward while we honor the past and acknowledge the present. You will also hear from members of our project leadership team, which brings together many different disciplines and viewpoints: oral history, public health, English studies, public policy, gender studies, and healthcare. Each will speak briefly about the significance of the project. Today, we will also show you the website where the project lives, and we hope you will return to it afterwards on your own and share it with your friends and associates. Now you will hear from Paige West, Claire Tao, Professor of Anthropology and the Director of the Center for the Study of Social Differences. Paige.
Hi, everyone. Thank you so much for being here today. I want to briefly say hello and welcome from the Center for the Study of Social Difference. We're an interdisciplinary research center at Columbia University, and we support projects that are collaborative in nature and that address gender, race, sexuality, and other forms of inequality. And we do this in order to foster ethical and progressive social change. We have two streams: women creating change and imagining justice. And this project brings those things together beautifully. So we are honored to be a part of this project. We're honored to have you all here today, and just thank you all for the work that you've done. And I'm excited to take part in the launch. Thanks.
Thank you, Paige. And now welcome from Murugi Indirango, Director of Columbia Global Centers, Nairobi.
Thank you very much, Jennifer. Welcome everyone, and thank you for joining us for today's launch. My name is Murugi Dirango, and I'm the director of the Columbia Global Center in Nairobi. CGC Nairobi is part of Columbia University's global network of centers that aim to create opportunities for research and scholarship. In addition to the Nairobi Center, Columbia University has established centers in Santiago, Chile, Rio, Brazil, Tunis, Tunisia, Amman, Jordan, Istanbul, Turkey, Mumbai, India, and Beijing, China. The Nairobi Center serves as a regional hub for research and collaboration as part of Columbia University's strategy to achieve a global presence. It links the African continent to Columbia's scientific rigor, technological innovation, and academic leadership. We are delighted and honored to be associated with the launch of this website that showcases our heroic African nurses sharing their experiences fighting the Ebola epidemic. This is a very timely launch, as Jennifer has said, considering that many of the lessons learned on the Ebola frontlines have been critical in the fight against COVID-19 in Africa and the world. Let me end by saying a big congratulations to all featured frontline workers. Thank you for the great work you do serving the world. Asante.
Thank you, Murugi. I would like to open this launch by lighting a candle and taking a moment to honor all the nurses and midwives around the world serving in the battle against pandemics, from HIV to Ebola to COVID-19, following in the giant footsteps and tradition of Florence Nightingale. Thank you. And now I have the honor of introducing Elizabeth Iru, Chief Nursing Officer, World Health Organization. She is the first nurse, the first midwife, and the first woman to hold this post. In that role, she has implemented reforms to strengthen countries' health systems around the world, including developing a national health roadmap, national health strategic plan, and currently the strategic directions for nursing and midwifery 2021 to 2025. Mrs. Iru is a trailblazer who models how nursing and midwifery can take our rightful place at the highest policy levels. Elizabeth?
Thank you very much, Jennifer. Really appreciate your words, but I think when you think about who's actually leading, I think nurses everywhere had contributed to those fantastic documents that you referred to. So we all had a part to play in this. But first of all, Jennifer, thank you for the invitation to speak at this very important event. It really is an honor for me to be here. I extend congratulations for this excellent and important initiative, celebrating nurses and midwives. Storytelling is such a powerful medium to capture the value of what matters, personal and professional life, and each one of us has walked through, reflecting commitments, compassion, care, courage, resilience, and even our vulnerabilities. The recognition of the value that these stories bring to our profession is irreplaceable. It is unique. And I thank the Columbia Center for Social Difference and the sponsors for recognizing and sharing this work with all of us. I'm sure as we hear and read the stories of these nurses and midwives, amazing work, emerging from different experiences and different backgrounds, their realities, it will move us. It will be powerful, I'm very sure. When we are responding to a health crisis, such as the 2014 Ebola outbreak and the COVID-19 pandemic, it might seem like we're in the battlefield. To many, that's probably the vision. But I want to say, because we witness friends, family, and our patients struggle and die, healthcare workers, and mainly nurses and midwives, are then considered to be the frontline troop, and will receive the applause from the general public and also from our governments. But I think we must not forget that we are health professionals at the forefront of a national response. taking leadership roles in our decisions and actions to ensure no one is left behind. And most times, these actions are not recognized or rewarded appropriately. We deserve respect, decent and safe working conditions. I believe the stories we will hear today and the stories of nursing and midwifery reality, stories from people who coped with their fears, those who continued to offer quality care despite the circumstances. Therefore, stories of leadership. It is important for us to remember this. I have often been amazed by the courage and resilience of nurses and midwives and their continued commitment to not only care, but to save lives. But who is caring for them? Who cares for the carers? Special attention needs to be given to the health, psychosocial needs and work environment of midwives and nurses and healthcare workers, especially in times of health crisis. The Ebola outbreak and the COVID-19 pandemic exposed many inefficiencies in our health systems. It exposed our vulnerabilities, but we must continue to seek ways to support our nursing and midwifery communities around the world. We must be better prepared for the next health emergency, for the next pandemic. And it leads to better delivery care for those who were unable to access health services because for now of the COVID pandemic disruption. This is why WHO is calling governments and employers to invest in nursing and midwifery. We need 6 million more nurses with decent work conditions and safe environment to work in. Get nursing right and everything else will fall into place. I believe we could learn lessons from these nursing and midwifery leaders' stories today and what they have done. So I wanted to say thank you for sharing and thank you for all that you do. And thank you for hosting this fantastic event and this fantastic launch. I really look forward to going through the website. Thank you very much.
Thank you, Elizabeth. And now from Sierra Leone, Joan Shepard, Principal of the National School of Midwifery and member of the Sierra Leone Nursing and Midwifery Board.
Hello, my name is Dr. Joan Shepard from Sierra Leone. I'm very excited to be a part of this great launch of the website for nurses and midwives. This is one of the historical events that we are looking forward to. The Ebola epidemic affected nurses in 3 West African countries, Sierra Leone, Liberia, and Guinea, and we lost quite a lot of nurses. Nurses should have their voices heard because they are frontline workers, and nurses are critical to the success of the healthcare delivery. So we are very, very, very proud of this great launch of the website where nurses and other colleagues can listen to our voices and our lessons that we have learned during the Ebola epidemic. Now we have COVID-19 emerging also as a new disease that has killed quite a lot of number of people. So nurses internationally and also nationally have a great role to play. It is important that the Columbia University has done a great thing by including us in this great launch to have our colleagues and our voices heard. We are supposed to celebrate the year 2020 as the International Year of the Nurse and Midwife. And unfortunately, our reserve and resilience is being tested by the emergence of a new disease. Together we'll make a difference. Together as nurses, we are the epitome of humanity, of humility, of strength, of great reservation. Our voices should be heard in a positive way. And one of the ways we want to influence our colleagues out there is to say to them, Ebola is real, COVID is also with us now. We're asking governments to put in place stronger infection prevention and control measures so that nurses, our clients, and communities will be protected. Long live to all nurses all over the world. Long live to nurses in Sierra Leone. I want to say a very big thank you to the Ministry of Health and Sanitation in Sierra Leone, the Chief Nursing and Midwifery Officer, the Nurses and Midwives Board, and to all nurses out there. I want to say a very big thank you to all of us. Let us keep our spirits high. Let us keep working for humanity, and let us give quality services out there to our clients and to all those who are interested in our care. Continue to register our support for nurses and midwives globally. We continue to register our compassionate and empathetic care to all humanity out there. And nurses, together we are going to stand. Together we are going to make a difference in the health care of our population of people who are under our care.
Thank you, Joan. And now you will hear from Cecilia Kapangbala Floma, Liberian Board for Nursing and Midwifery.
A remarkable one where nurses and midwives can be recognized for the role they played in promoting and improving the health of our world and populations. Recognizing today that nurses and midwives are the frontline soldiers of our health system is a great pleasure for us. And today's program for me is remarkable in that authorities can recognize the work and support of nurses and midwives globally. Fighting Ebola was not an easy task. Personally, as the head of the Liberian Board for nurses and midwives, witnessed nurses and midwives in a very tough situation. Nurses, midwives worked with limited supplies all around Ebola treatment units. They worked at the policy, advocacy levels, and also coordinated at all levels in helping Liberians to overcome the Ebola outbreak. And let me say again, I also witnessed Liberian nurses and midwives fighting the recent COVID-19 that is still going on. At this juncture, I want to say I recognize the strength, the competence of nurses and midwives in fighting all outbreaks. Let me extend my congratulations to nurses and midwives for winning different battles in the midst of limited resources, especially for developing countries. I also want to extend my deepest sympathy to families who lost members while they were restoring the life of others. Let me thank the organizer of this unique event because it's always good to recognize nurses and midwives for the role they play. Thank you.
Thank you, Cecilia. Courtney Vos, Vice President and Chief Nursing Officer, New York Presbyterian Columbia Allen Hospitals, New York City. Courtney?
Thank you so much. I'm absolutely honored to be here with you today, celebrating the voice of nursing as advocates, change agents, leaders, and decision makers from the bedside to the boardroom. There were and are so many lessons learned during the Ebola crisis and now the COVID-19 global pandemic. Nurses have always been there to step in and up to any challenge. We're the ones who are there day and night. We're the ones who spend the most time with patients, families, and each other. We're always there, and yet we're not always there when policies are written. Is nursing at the table when decisions are made regarding emergency response? This is not a political statement, but we had to petition to have a nurse added to the Biden COVID-19 task force. Our nurses, the most trusted profession in our nation and likely the world, for 19 straight years. Did we learn everything we could about how to care for others and ourselves from the nurse warriors who fought Ebola? The lessons learned were transferable. They were not pathogen specific. In honor of International Women's Month, if nursing were a predominantly male profession, would we have to ask to be at the table? We must have a more powerful voice, a voice that is heard, a voice that is not just heard, but that influences decision-making and policy. I am grateful to all the nurses who battled then and now, and to Columbia University School of Nursing for providing this program, this website, this voice. I believe this will help me to be more proud of the answers to my questions in the future. Thank you for affording me this time with you. Please be safe out there. Back to you, Jennifer.
Thank you, Courtney. And now words from our On the Frontline team members. From Zambia, Mwanza Nkowane, member of the WHO Afro High-Level Consultative Group on Health Workforce.
Greetings to all attending this launch of the website on the Frontlines Nursing Leadership in Pandemics. The launching of this event during COVID-19 pandemic shows how resilient, adaptable, and committed nurses and midwives are to whatever they embark on doing. It has been 3 years since I retired from my job at the World Health Organization in Geneva as a Global Technical Officer for Nursing and Midwifery, a position I held for many years. I also remember that in that retirement year, I attended the 2017 International Confederation of Midwives Triennial Congress in Toronto, Canada. It was such a pleasant surprise to receive a call from Jennifer Dohrn, one of the coordinators of this project on the Frontlines, telling me she would fly over to see me in Toronto as it is a short flight from New York. Jennifer came to Toronto and we talked about social and professional issues. But what stuck in my head was the conversation about some work she had done on documenting stories around death from women. She emphasized the importance of storytelling and its power to help people cope and make the necessary adjustments. I was impressed by this. But since I had retired, I did not dwell on it. So when Jennifer a year later raised to me the prospect of the current project, I did not hesitate to join the team. I felt I had rested enough. It was an invitation I could not pass. Our journey as a team has taken us to Liberia and Sierra Leone, where we interviewed brave nurses and midwives who sacrificed so much to save lives during the Ebola outbreak of 2014 to 2015. The interviews revealed strength, bravery, compassion to help others by these frontline nurses and midwives. For us, it was an opportunity to listen to their voices, their wisdom and experiences which are often ignored. Colleagues, the voices of the nurses and midwives have been audio recorded and documented. We can revisit these stories over and over again. We can get a deeper understanding. We can strategize, find solutions, and implement best practices. We can be understood by other professionals, politicians, and communities. With these compelling voices, we can effect change. We can no longer make speeches that say nurses and midwives' voices should be heard. We can say we know how we can make nurses and midwives' voices be heard, and show you where you can find examples of their voices and how we went about to effect change. This offers a good foundation for future initiatives, including the research I'm leading here in Zambia on nursing leadership during COVID-19. It is really an honor to be part of this project. Congratulations to the project team at Columbia University, to the nurses and midwives in Liberia and Sierra Leone for making the achievement of this project milestone a reality. Thank you.
Thank you, Mwanza. Susan Michael Strasser, ICAP, Millman School of Public Health.
Good morning, good afternoon, good evening. I would like to thank the Center for Social Difference, Jennifer Dohrn, and the On the Frontlines team for including me in this oral history project. Together, we have attempted to capture nurses' voices, their lived experience, and their history, to give full attention to the insight they can bring to building stronger health systems able to plan for, predict, prevent, detect, and respond to any health threat. As a nurse and public health professional, I have been humbled to be a part of this project. Throughout our time together in Liberia and Sierra Leone, I was reminded of what nurses will do and sacrifice to save a life. Actively listening to these nurses recount their lived experience as frontline providers in Ebola treatment units was harrowing. It is something I will always hold dear as a stark reminder why, as nurses, we must use our voice. Learning from history is central to the development of societies and the progress of humanity. But how we learn from history is up to us. Nurses have always used their voice to advocate on behalf of their patients, but their voice, our voice, is often not heard or, more importantly, heeded. We cannot and must not stop telling the truth of what it is like to be on the front lines trying to save lives despite inadequate protection or support in fragile health systems. As societies, we continue to fall short in protecting our healthcare workers. The risk for healthcare workers is high, especially early in a pandemic, and data has shown us from COVID to Ebola that nurses are at the most risk to be infected and to die in the line of duty. The psychosocial impact of working at the front lines, including moral injury, are very real. The nurse's story is critical to building back stronger, whether we are in New York City, Freetown, or Monrovia. We must build health systems that are prepared for both anticipated threats and threats yet unknown. As COVID has shown, nurses will continue to show up and be on the front lines despite the risks and challenges. Whether that we heed their wisdom is up to all of us. Thank you.
Thank you, Susan. Mary Marshall Clark, Center for Oral History Research. Mary Marshall.
Okay, hello everyone. I'm so honored to be here today. I'm overjoyed to be with all of you, whom I respect so much. I'm gobsmacked by having Elizabeth Ito, whose work I so admire, become a part of our seminar. I want to say what a beautiful collaboration it's been for me to give some support to the amazing interviewers on this project. I think that this project really reveals the power of oral history to create global dialogues and connections across social distance. And in a time of social distancing, the digital archive becomes even more important as it's been created by the brilliant and wonderful Alex Hill, who will be speaking to you about it in a moment. I can tell you from 30 years of working at Columbia and in the field of oral history that there will be countless researchers, students, writers, playwrights who come and listen to the interviews with great, great care. And I'm proud to announce that our Center for the Study of Social Difference has agreed to allow us to contribute our own oral histories from the Center for Oral History on COVID-19 in New York, where we've interviewed about 30 nurses here, to this archive sometime in the fall. And so researchers and students and poets will have even more to work from by looking at the lessons learned between the two projects. I want to say that, first of all, our thanks go to you as the nursing leaders and practitioners in West Africa and midwives for giving us your lessons from Ebola, lessons the West should have learned long before now. We're still learning. One of the crucial things we're learning and working together with now is that the call for that oral history is not only a form of commemoration, documentation, and analysis, it's a call to action. That's how we teach oral history at Columbia. And so it's extremely important to say that in our project, both projects are looking at the issues of equity, fairness, in the, not only in the treatment and the fight against COVID, but in the rollout of the vaccine. And I think that's very important for us to acknowledge that while distribution is happening in Europe and the United States, there's still whole nations in Africa who have not received a single dose. And that part of our effort in this project is to stand with you in the fight for equity. Thank you.
Thank you, Mary Marshall. And now from Malawi, Margaret Peary, ex-regional nursing and midwifery advisor for WHO Afro and now midwifery advisor, Seed Global Health, Malawi.
Hello to the brave nurses and midwives of Sierra Leone. We know and we have learned and heard that you saved thousands from Ebola in Sierra Leone and that you are still racing to revive your country's health system. More importantly, we know you had to do what you did because you could not just see your people dying. The official launch of the Frontlines website today for your country as nurses and midwives marks the beginning of the long-awaited journey of giving recognition for the great job you did during the Ebola pandemic. The website has been created for us and people worldwide to know you as nurses and midwives who have been on the front lines of human care for centuries. Your traditions and skills have been essential in birth and are still essential, life and death. Therefore, when our political leaders, the policymakers, and everyone interested in service to mankind go to this Frontlines website, our hope is that reading through this website and listening to your voices will compel them to take action to recognize your contribution towards saving lives in your nation and to help you do more and even better. Keep up the good work, and thank you all. God bless you.
Thank you, Margaret. Wilmot James, Center for Pandemic Research, Institute for Social and Economic Research and Policy.
When the West African Ebola outbreak took place in 2014, I was a member of the South African Parliament and the spokesperson on health for the opposition. And what we wanted to do was support what was happening in West Africa. And it is very clear that all the health workers were placed at risk. And at the forefront of the risk were nurses and community health workers. And so one of the most important things we wanted to do is support them in their efforts. And we need to understand what the nature of that risk is. We're not talking about a category of people simply. We're speaking about real living human beings who are mothers, who are sisters, who are the daughters and sons of parents. They're part of families. And what they do is they put their own lives ahead of themselves to take care of others in exercising the Hippocratic Oath. And therefore, it's really important to support them, to understand that what they are doing is placing themselves at risk. And what is required is for us to not only tell their stories, but to honor them in everything it is that we do when we come to looking at and reviewing pandemic response. And so I really want to say that this website that's being launched today is the most important element of a project we started a few years ago in order to record the stories of frontline nurses in the 3 West African countries affected by Ebola, so that we can honor them and we can say that their contribution has been invaluable, that we've noticed, and that we want to record for posterity the stories on the website that we're launching.
I also want to acknowledge Jeremy Arloff, who was central to our team during our visits to Sierra Leone and Liberia, in overall making this project come to life. And now Alex Hill, Columbia University Libraries, will show us a walk through the website. Alex?
Hi, thank you, Jennifer. I'm very honored to introduce to you the website for the Frontline Nurses project, which you can visit yourself as of now at frontlinenurses.columbia.edu. I'm going to share my screen now to start our tour of the website. Now, this is the homepage of our website, which you will see if you yourself visit it at frontlinenurses.columbia.edu. Now, Jennifer, can you please confirm really quick that you can see my screen just fine? All right, on the homepage, you will notice that we have 2 major sections, one for Ebola and one for COVID-19. the section for COVID-19 is a work in progress. So we will have a second release for the website when that section is complete, allowing us to compare and learn from the shared voices of the nurses from West Africa that we're celebrating today with the nurses that will speak in this section in the future. Now, you will also find on the homepage a menu icon at the top right that will allow you to navigate to the different parts of the website as well. Let's go to the Ebola section now, which is the main part that we are launching today. In this section, you will find the main event, which is the collected voices of the nurses at the front lines during the Ebola crisis in West Africa by clicking on this top link. Before I click though, I want to also point out, and we will revisit these shortly, that we have also created a timeline of events during the Ebola crisis that can help us, people who are new to the historical events that unfolded, more or less navigate in an interactive environment. And we will look at that in a second. And also you can navigate to a history page from this Ebola page. We will revisit these in a second, but let us now visit the page where you can explore the different voices that were collected during this oral history exercise. Now, we created an interface that highlights the nurses themselves. We wanted to make sure that the whole website sort of pointed at the dignity, the authority of the nurses that have given us their voices and their experiences, that have shared them with us. Now, to navigate to any one of these recordings, you would select a nurse to listen to. Now, we have prepared some for you, but the first one we're going to listen to is one of the most impactful ones, at least for me, and the team selected this is Diana Sarte. And for example, to select Diana's interview, we would click on Diana's picture, and that would take us to Diana's page. Now I have it open here on the site already, selected to precisely the place in the interview where we wanted to give you that sample of the interview. So I'm going to press play, and we're going to listen to Diana for a second here. So raise your volume if you don't have it. For those of you who are following along on the website itself, once you're in the page for a given nurse, you navigate beyond the picture of the nurse, past the description of the title of that nurse, the brief bio, to this little interface right here from SoundCloud that allows you to play the interview. Now, what I'm going to play is a clip a little bit advanced in the interview. So if you press play, it would start from the beginning. I'm about to press play halfway through. So this is on minute 11:55.
What is one of the biggest things you learned from that? So from that experience, I learned that you have to be qualified. You have to be a trained practitioner before entering such place. So once you are not trained, you get infected. And then that anybody can just work in ETU. You have to be trained. And you have to be a real nurse. Because even if you're a nurse and you don't have passion for your profession, you will just enter the unit and just look at patients and just pass by them.
What are you most proud of from that time and the work you did?
So what I'm most proud of is I work in the Ebola unit with Ebola patient. That is the pride that I have. Most people wouldn't want to work there. But I'm proud that I can be counted among the nurses that worked in the Ebola unit, even if I don't get anything, because during the whole Ebola crisis, we did not benefit anything. There wasn't any scholarship to say, oh, these nurses did a lot. They sacrificed their lives. They worked tirelessly on all those years. But at least after this whole episode, at least we must appreciate them. Even if it is a training out of the country, even if it is a training that will improve their lives, it should be happening for them, but it wasn't done. Even our hazard benefits for entering the unit, for working with Ebola patients, for risking our lives, we were deprived of it.
You didn't get that, and you haven't gotten it.
No, not.
All right. So just let's listen to another voice here. And of course, I want you, after we finish here today together, to go by yourself and listen to all of these voices. All of them have something for you. Let's listen to one more while we're here together. Let's listen to Christiana Conte. Now, in Christiana's page, I also select, our team also selected a minute. We're in minute, oh, sorry, I'm trying to, I click by mistake. We are in minute 19:20, 19 minutes and 20 seconds.
And the communities after since the Ebola been coming down, do you think things have changed? Yeah, as you rightly said, the human being habits, behavior is something that is very difficult. So we know that. We're having a major challenge amongst healthcare workers, the behavioral change. Because it is very clear that hand hygiene alone can actually remove up to 80 to 90% of microorganisms. For you to get healthcare workers to comply to hand hygiene, it's a big challenge. But then it's also constant monitoring. You have to monitor constantly, mentorship and on-job trainings. Amongst the community, we had a whole lot of negative feedbacks from them. And even when you tell them to wash their hands, the basic hygiene, they tell you, if I wash my hands, do you have food to give me? So a whole lot of people, dropped hand hygiene despite ongoing sensitization, health education, community engagement. Some are doing it, but some still, we still have to work hard to win them over so that we get them doing it continuously. They are still.
All right. So I hope the small previews make you excited to go and visit this gallery of voices and explore these oral histories by yourself. Remember, all you have to do is select a nurse and click on it, and you will be taken to that interview. That interview, you will also find in the interview pages that there are transcriptions. For those of you who have perhaps a difficult time listening, you can read the transcription of the interviews below each interview. Now, just really quickly, I wanted to show you some of the other parts of the website that are ancillary to the voices that help us put the voices in context. So I'm gonna go to the timeline to show you more or less how it works to perhaps convince you that it can be a great tool for teaching those who are new to understanding the crisis. And we'll do a similar one for COVID. So it works very simple. You navigate from chronologically from earliest time to the latest time, month by month, event by event. You can use the top navigation to sort of cycle through the different events, or you can actually use the bottom one to select the specific events. I will let you play around with it, but we think it's a great teaching tool that can be used to introduce new audiences to the crisis. In addition to the timeline, we also created a historical essay with some pictures that can help provide a little bit of more context for not only the crisis, but how it connects to the voices that we're trying to celebrate today and raise today through the website. In addition to these teaching materials, the site also includes a series of reflections by the team members of what it meant to them. We thought that it was important to actually have ourselves be, take a moment to reflect on what we've learned and what we think we are doing together. Now, to navigate to this reflections page, you go to the menu on the side, and right below COVID-19, you will find the reflections. We also provided, an about page, which is very common in websites today for those coming to the site and needing a little bit more guidance. Together, all of these pages provide the Frontline Nurses site 1.0, the first version, the one that centers and celebrates the voices of our nurses in West Africa. And with that, I pass it back to Jennifer.
Thank you, Alex. I hope when we finish this webinar, everyone will open this site and look through it. It's just so rich with material, and hearing everyone's voices and stories about what they faced, what they did. It's just an experience that will stay with you forever. So now we will have closing remarks from Victoria Rossner, Columbia School of General Studies and Department of English and Comparative Literature. Victoria?
Thanks, Jennifer. I'd like to conclude today by reflecting on the work of our group and what we hope it can accomplish. When we began this project together in 2018, we of course did not know that COVID-19 was on the horizon. While the current pandemic has deepened the state of global health inequities and in turn changed the scope of our project, our overriding goals remain the same. Our first goal is to document the work of frontline nurses and midwives in combating pandemic outbreaks. Almost all of the nurses we've interviewed about Ebola told us that their work went largely unacknowledged, unrecorded, and unthanked. This is a truly terrible omission. It is also a deadly waste of accumulated knowledge that could be used to prepare for future outbreaks. The nurses whose work we document on the site turned around an epidemic with an overall case mortality rate in excess of 40%. And they did it in the context of supply shortages, a weak healthcare infrastructure, and the lack of either effective therapies or a vaccine. The world can really use that kind of skill. The second goal of this work is to move the insights of the world's nurses into a position to influence policy. When the student associates who are part of our project did a broad survey of international health policy guidelines, they found almost no inclusion of nurses. Why is this the case when nurses form the great majority of the healthcare workforce around the world? It's time for a change. This takes me to the third and final goal of this work: to make explicit the role of social difference in organizing authority during healthcare emergencies. 80% of nurses in most regions of the world are women. And although women comprise 70% of the global health workforce overall, they hold only 25% of health leadership roles. Gender also intersects with race and class, as well as histories of colonialist exploitation. These factors compound the readiness with which nurses' views are set aside and nurses' sacrifices are dismissed as ordinary, unworthy of recognition. We need to see authority figures in our nurses. We need to see nurses as authority figures in pandemics. That's why on our site, nurses are telling their own stories on their own terms through the methodology, as Mary Marshall described, of oral history. They are the authors of their own accounts, just as they are the authorities in pandemic response. Time's not going to allow us to open up for questions today, but there is so much expertise in this audience, and we would love to hear your responses to the project. Please write to us through our Instagram account, Frontline Nurses and Midwives, Frontline Nurses and Midwives. That's on Instagram, or contact us through the website. As you've heard, this spring we're expanding the website to include oral histories of nurses on the front lines of the COVID-19 pandemic, and we hope you'll circle back to the site to read those stories as well. Despite the not inconsiderable challenges of the moment, and I know that people in this audience around the world are well aware of them, I still want to close this event by sharing my personal immense gratitude at having had the chance to do this work and getting to know the people involved. Many of them you've heard from today, and they are truly the most committed, fearless, and passionate people I have ever met. I also want to highlight another group you didn't hear from, the dozens of Columbia students from the School of Nursing and the GS Postbac Pre-Med program who over the past several years have volunteered their time, a lot of their time, to prepare the material on the website, led this year by Kurt Haluba and Mina Shah, and last year by Jeremy Orloff. These students are extraordinary in their talents and their dedication, and they are really the future of this project. Most recently, these students have launched a social media campaign on Facebook, Twitter, and Instagram to call attention to nurses' stories. Please have a look at this work. It's fantastic. The links are posted in the chat. I also want to mention that our group will be holding another event on the morning of March 31st on crisis communications and vaccine uptake in fragile African settings. I hope you'll join us for that conversation as well. Finally, thanks to you all for coming today to hear about the work of Frontline Nurses. Thank you for all the support you've been expressing in the chat. It means the world. Please share the site, help us expand the audience for the stories of these heroic professionals. On behalf of Jennifer, on behalf of all of our speakers, thank you so much for being with us today. Take care, be well, bye for now.